Good morning, board, community partners, and the public. If yesterday was Super Tuesday, one might suppose that today could be Consequential Wednesday for some people. The chair calls the March Board of Health meeting to order. This meeting is virtual and being streamed live on Facebook. As well, we welcome Dr. Karen Shaw to the board to fill the vacancy created by Dr. Tony Zippel, who resigned after 10 years of invaluable contributions to the public and to public health. Dr. Shaw, an emergency medicine physician and entrepreneur, was duly appointed by the mayor and confirmed by Metro Council. Dr. Shaw received his medical degree from Wake Forest University School of Medicine, completed his emergency medicine residency at Vanderbilt Medical Center, and received his master's of management in healthcare at Vanderbilt's Owen School of Management. Welcome, Dr. Shaw. The chair will recognize you for comments following our perspectives session. The minutes from the February board meeting have been circulated for your review. Are there any comments? Are there any edits? And if not, the chair will entertain a motion to approve the February board minutes.
So moved.
Oops.
Second.
Okay. Are there any objections? The meetings stand as approved. Let me note up front one additional item. Our next Board of Health meeting will be Wednesday, April 10 at 8 a.m. Given that JCPS is Jefferson County Public School Systems, spring break is the first week in April. That perspective session will examine food as medicine. Dr. Ted Smith, PhD, U of L School of Medicine Associate Professor of Medicine Pharmacology, and an internationally recognized leader in the area of environmental determinants of health. He is a director of the Christina Lee Brown's Center for Healthy Air, Water, and Soil, and he will lead this session. He is also one of our community advisory board members and will share insights and learnings from his attendance and breakout discussions at a large private food as medicine conference in Brazil for highly respected global philanthropies. A draft public policy will be offered for adoption by the board. Today's perspective session, and I'm going to go on to some business because I don't see our speakers yet, and we are running very early. At this point, then, I'm going to ask Dr. Shaw, any comments you wish to make to the board?
I just want to say thank you for the opportunity, and I look forward to working with all of you. So thank you very much.
Terrific. Terrific. Let's see. Dr. Single, or let's see, are you not yet? Dr. McKinney, interim dean of the public health school. Are you on? I see you're.
Yes, I am. Thank you very much, Heidi. And we anticipate by the next meeting of the board, April 10th, we will have Dr. Catherine Cardarelli on board as the new permanent dean of the School of Public Health and Information Sciences. So we're anxiously awaiting that transition, and you look forward to her being added to the regular group of attendees here.
And she comes to us from, you want to give a little background on her?
Yeah, so she's from the University of Kentucky, and she is a senior vice provost there. So she works not only in the School of Public Health at UK, but also with the other units, that is the other colleges or schools in the university system at a very high level, with faculty affairs issues, budgetary issues. She is an epidemiologist by background, and received her undergraduate training at the University of Texas system and her public health training at University of North Texas, and has been at UK for approximately 10 years. So she has 2 children, one of whom is graduating from high school in May. And so she'll be making sort of a gradual transition from Lexington, where she lives currently, to Louisville, to be concluded by the time graduation is complete for her son. And we look forward to, full engagement with her after that time.
Terrific. As the board may be aware, I have the honor of serving on the community advisory board for the School of Public Health, and very important to me to be to join those voices. And excuse me for doing what I'm doing, which is to figure out who has joined. Welcome, Dr. Hargett. We'll see who has joined. Dr. Hargett, do you have any comments from the Greater Louisville Medical Society or information or announcements that you wish to share?
Yes, I do. The Greater Louisville Medical Society participated in their annual day at the Capitol, in which we visited state lawmakers to promote items and an agenda that we felt that is important to include: gun violence, prior authorizations, mental health, etc. We had approximately 100 physicians to turn out from around the state. We met with our representatives, and we felt that we had good communication. And so I think that the biggest thing that we saw input is on prior authorizations. We all know how that impacts physicians as well as their patients. And so I think that's going to be the biggest takeaway from our meetings with our representatives. Also, this past Saturday, we had our doctor's ball, which is put on by the GLMS Medical Foundation, and it has been on hold due to the pandemic. So this is the first time in 4 years that we held our doctor's ball. We had 5 different physicians that were recognized for their work in the communities, including the 3 health systems in Louisville: Baptist, Norton, U of L, as well as Community Physician of the Year. And that is particularly done to recognize physicians and also to raise money for the GLMS Foundation. And so those are the 2 big things that I wanted to bring up as what's going on most recently with GLMS. And thank you.
Thank you very much. Any questions for Dr. Hargett?
Dr. Hargett, can I ask one quick question on prior auth? Because that's sort of near and dear to my heart. What, in terms of, clearly we see it is a big issue and for physicians, and a lot of time that they spend doing that, and that takes them away from patient care.
Right.
Do you see anything changing from the insurance side of things? Because that is sort of sometimes a barrier, right? I mean, 85 to 90% of prior auths get approved anyways. So it's almost an unnecessary barrier and delay in patient care.
Well, the point is we're hopeful. As you know, the KMA, GLMS and the KMA, as well as the other medical societies around the state, work in conjunction under the leadership of the KMA. And so we're hopeful that, again, that was our big takeaway from our meetings, that the representatives and from around the state seemed very interested in that, because a lot of them and their families have experienced, the problems and consequences of not getting authorized or on a timely basis and those type of things. So we do think that they're going to be taking that up, we think, and really looking at that. So we're hoping that it's going to be moving forward.
Thank you.
Great. Arlena, can you check on our speakers, please? I think I told them 8:10.
Yes, ma'am. I will check on it. Yes, ma'am.
Thank you. make sure they're, let's see, where did I see, Ms. Manson?
I am here.
Excellent. Would you
I'm
like
here.
to share while we're waiting for Arlena to come back?
Absolutely. I just wanted to let you all know that the Kentucky Nurses Association has been working very hard on some legislative issues, one being HB 159. And if you have an opportunity to call your senator to say, please vote for HB 159, this reduces and eliminates decriminalization of medical errors. And so we would appreciate that support. We have a number of others that we are supporting. One in particular that we are opposing, where providers get the opportunity to say who they will care for and who they will not care for. And that bill is Senate Bill 239. So please let your legislators know that you are opposed to providers having the responsibility and opportunity to decide who they will care for if they do not agree with their lifestyle. And these are two really important bills for healthcare. And we would appreciate your support.
Thank you. And I see that Dr. McNary has joined us. So I will.
Hi, Lacey.
There we
Morning.
go.
Good morning.
Is it Jaime? I want to make sure I'm saying it right. Okay.
Yes, hi.
Thompson. All right. Well, let me go back here and say the chair will yield the floor to Dr. Bautista Cervera for an introduction of our speakers and for the perspective session. And as you know, they'll speak for about 15, 20 minutes, and then we'll have Q&A. And as you know, the chair will interrupt to make sure that we get everyone out on their schedules and to give notice to the speakers that they have a little time remaining. So, Madam Vice Chair, the floor is yours.
Thank you, Madam Chair. Good morning to all. On March 1st, President Biden declared March as Social Work Month. He described social workers as an essential part of workforce. I would say they are an essential part for the public health workforce as well. Individuals who are highly trained professionals who develop to respond to crisis, support those navigating life's most vulnerable moments, and who also advocate for.
Please, so that, including Heidi.
Can you hear me? Can you hear me? Okay, thank you. So social workers are individuals who are highly trained professionals who respond to crisis and support those navigating life's most vulnerable moments, and who also advocate for people in disadvantaged situations. Today, we welcome two very special social workers with many years of experience, and they are researchers who have worked on policy development and are child, youth, and family advocates. As we have read on the bios that were previously described, Dr. Lacey McNary, DSW, is committed to and passionate about the need for systemic change to improve all well-being on every child, family, and the whole community. Her work in advocacy campaigns and research studies over the years has been centered on providing outcomes for children, youth, and families. Jaime Thompson, MSSW, is currently working on addressing human trafficking. She's also a researcher, and all her research and the methods she uses are to promote empowerment and resilience for vulnerable populations. Please, at the end of the presentation, share your thoughts or ideas regarding how the Board of Health's mission may be fulfilled by addressing victims survivors of human trafficking needs for equitable physical, behavioral, and environmental health. And let's all discuss what health-related policies at the local level are needed and how they should be enacted. Jaime, the floor is yours.
Hello, can everyone hear me? And Lacey, you want to do a test, Lace? Is
I'm
Lacey
sorry,
here?
Jaime, what did you say? I couldn't hear you.
Oh, I just wanted to make sure you could do a test with your You're on too. Okay. Well, welcome everyone. We're so pleased to be invited here today to give you a very quick presentation about the landscape analysis on human trafficking that we conducted with a large group of partners, particularly Metro United Way and United Parcel Service in 2020. Hard to believe. Lacey, I was going to ask if you, I'm going to try to share screen for the presentation, but if it doesn't work, I want to ask you to be back up.
Sure.
Okay, I need you back up.
Okay, let me pull this up.
All right, just to give some context to everyone too, this landscape analysis is still a living document. We know that there are lots of areas within our analysis that needed deeper diving, and in the public health arena, particularly around the ways that we can look at social determinants of health, as well as other preventative factors that can help reduce the risk of young people and others being trafficked. And this slide deck is available for you after the training as well. The presentation as well. And if you didn't get a chance to preview the report, I really would challenge everyone today to take some time to scan and review the report so that you're building knowledge around what the preventative measures are that we need to take in Louisville to respond to human trafficking, but also how we respond to occurrences of trafficking. Lacey, did you want to add anything else?
I was just going to add a little bit about McNary Group before we get started. Thank you so much for the introduction, and I love the tie-in to Social Work Month. That's really great. And yeah, so McNary Group, we do a lot of work in the community, worked for the last 10 years with about 120 or more projects, doing a lot of research, community research, qualitative is one of our favorite things to do, talking to people, bringing voices to issues, to those who make decisions. And just a little bit of background, I worked at a child advocacy organization, Kentucky Youth Advocates, for 13 years before starting my consulting practice. So that's kind of my background of spending a lot of time at our state capitol, working on children's issues, and very happy and thrilled that we're able to still do a lot of that work in this role, working with Jaime and my colleague Erin, and touching a lot of issues in our community, and like I said, bringing them to folks that can make decisions. So that's it, Jaime. Should I go to the next slide?
Yes, thank you. And as a professional social worker, I also want to give a shout out to Patricia for honoring and recognizing the important role of social workers. And we're all connected, right? So thank you so much. All right, so I wanted to set up a background of when we're thinking about demographic groups for us, when we're looking at solutions and we're looking at targeted messaging to help us increase awareness around human trafficking. And of course, in our country, human trafficking laws have been on the books at the federal level since 2000. And then in Kentucky, starting in 2007 and in 2013. And those involve force, fraud, and coercion. So if you can just remember those three words today: force, fraud, and coercion, of individual humans at any age for their sex or labor services. In other countries, there are higher risks for child soldiers and child brides, although we still have child brides here in the United States as well. We particularly focus on sex and labor services of human beings. So we really know that children, the child welfare systems, the juvenile justice systems, including foster care, are at a very high risk to be trafficked. And the reason why is that they are very vulnerable. That's the other word I want you to remember today. So force, fraud, and coercion, and then vulnerability or vulnerable. Anyone can be vulnerable to trafficking, but we know that experiencing trafficking, but we know that there are groups that we need to give special attention to and use a lens to look at problem solving. unhoused youth and youth who have run away. And then, of course, unaccompanied foreign national children without lawful immigration status. And because we live here in Louisville and we are, I believe, the 7th or 8th city with different languages spoken and populations, we need to be attentive to that vulnerability. Also, those who are seeking asylum, American Indians and Alaska Natives, particularly women and girls. We really do need to start targeting women and girls in ways that allow us to meet their basic needs and other vulnerabilities so that they are not in a position to sometimes be pushed into a trafficking situation. And with human trafficking in our country, it can be sex and labor services at the same time. So that intersectionality can really be hard for women and girls because of limited opportunities. Those with substance use issues, racial and ethnic minorities, migrant laborers, including undocumented, and those that are participating in visa programs for temporary workers. We also have, Kentucky Refugee Ministries and Catholic Charities that work really a lot to link folks to the legal system, but there's still a lot of fear and stigma around that as well. And then foreign national domestic workers in diplomatic households, we definitely have had trafficking situations here in the state that have to do with domestic servitude. So that is just another area that trafficking can occur in. Of course, people with limited English proficiency, persons with different abilities or disabilities, and the queer community, all members of the LGBTQ plus population, and then of course, intimate partner violence and other forms of domestic violence. Okay, so I hope that that was educational if you are new to understanding who trafficking impacts. So I know we have to go pretty quickly, so we'll go to the next slide. What was the aim of the project? Really, the overarching objective at this juncture in 2020 was to help us understand a more comprehensive view of what trafficking looks like in our particular region here in Louisville, but of course we considered the state as well. And a landscape analysis allows us to scan the landscape and understand a phenomenon. And with a phenomenon such as human trafficking being so complicated, we had to look at multiple systems. We highlighted experiences, gaps, and needs of young people in the city. And that's because we are seeing high numbers of those individuals being trafficked in our state, particularly in our city of Louisville. And that includes the ages of 16 to 24, as well as younger folks. And all right, Lacey, you want to add anything else about our partnership with Metro United Way and a lot of our great partners we had?
Sure. In this work, we convened an advisory committee to help us lead the research efforts, knowing that several groups are already working on this issue or are touching it at some point in their organization. So this advisory committee was with us every step of the way, helping us design the research and implement it and analyze what we found. So that's really important to us. We also, Jaime, you may be getting to this, but we also, in our participatory approach and qualitative methods, we talked to, I believe, about 75 folks in the community, either who were survivors of human trafficking or served them in some way or was involved in the ecosystem of human trafficking in Louisville. We additionally did a community survey. Well, actually, it was more of a survey to service providers in the community to understand how they intersect with this issue at their organizations.
Great, thank you. That's perfect. Next slide. So these are the systems we identified. And as you can see, public health and medical are combined, but this was a system intersection that we were able to explore in some ways, but we needed more of you with us. So for this board in particular, how can the public health system increase either available services or look at those higher level 3,000 foot view policies that are essential? I love Metro and Highways campaign, safe and affordable housing is prevention of human trafficking. Anti-racist policies is prevention of human trafficking. Fair wages and young people being offered opportunities to advance in their adolescence is also really important. So we know that public health is an important system. We particularly were able to really get into the housing issues and how the community-based organizations and other organizations serving survivors and, of course, victims who haven't been identified yet have an essential role in that pipeline to get out of their trafficking situation. Human trafficking is a complicated social problem similar to intimate partner violence or child welfare. There are just many different facets that go with it, but the exploitive nature of this crime makes it essential for all these systems to be connected and understand the ways that we can better serve survivors and victims. Okay, next slide. I know we're moving fast. We're not going to read these quotes, but I would like to just encourage you to go to the report to read quotes, to hear the voices of the survivors. This particular survivor, she had been kept in a house near Churchill Downs for nearly 2 years, and her children were with her too. Her children were enrolled in school, but the trafficker had such control over the family, she was not allowed to leave the house for 2 years, and she was a survivor of labor trafficking. And then some of the young people here, you can go to the next slide, Lacey. This young woman, she had gone AWOL, which is social work term for leaving residential treatment, over at one of our local residential treatment centers. She ended up finding an older man in her community that was able to provide her housing. And then within 2 weeks, he was trafficking her to other men in West Louisville. So please remember as well that when we listen to survivors' voices, we can get deeper understanding of the causation and the why. And that can really be helpful when we create policy. All right, next slide. Okay, next slide. I know we got to move quick. So some of the highlights from our findings were that there are gaps in available, safe, and affordable housing for human trafficking survivors. This could be an area that this board looks at in particular when it comes to policy around how we set up the healing journey and the treatment for human trafficking survivors. Because if you don't have housing stability, you're still in that vulnerable position, vulnerability to be trafficked. Education and training opportunities are available in our community. We have People Against Trafficking Humans, Coalition of Kentucky. We have the Bakita Initiative at Catholic Charities. And so existing prevention services in our region offer opportunities. So we don't have to recreate the wheel, folks. We know there are plenty of federal education from the Office for Victims of Crime that can help us spread the word. There's a need to explore a connection between human trafficking and other problems. Children and young adults are vulnerable in our community. They need more comprehensive services. When it comes to responding to human trafficking, you're going to have complex trauma, food security, housing security, mental health treatment, all of these things that are important to be available. Children and adults in some groups are falling through the safety net, and that is in particular for our children aging out of the foster care system and those who don't have family or community support. Okay, next slide. Funding for prevention, it's pretty fragmented. So this, unfortunately, in a lot of response models, allows for larger possibility for silo work, and that is definitely happening in Louisville. However, the silos have been connected more because of the work in this region. Collaboration's happening, but there's also a need to improve coordination in the anti-trafficking work in the city. And we need more understanding of the available resources, and we need to actually create resources too. So availability of resources, and then the gaps in resources were a big finding. And then increased opportunities for awareness and education. So just those pieces right there are findings. All right, what's our time when you guys releasing from your meeting? I think we're
Or how much time do we have to keep speaking?
Probably a couple of minutes.
couple minutes and then we'll have some discussion. Gotcha. Okay, great. I just want to keep us on time, so I appreciate everybody. When it comes to recommendations, before we begin our discussion, once again, that lens for this board, your areas of expertise, and going back to understanding force, fraud, and coercion are the acts to exploit humans in sex or labor services, and that if we can decrease vulnerability and increase access to resources, we can greatly make a difference in that person's life. So when we think of the prevention piece, that's there, but then the response really needs to be trauma informed. And this is at all levels. This is the medical providers, our law enforcement, our social workers, and first responders. First responders, like, for example, emergency medical services, they oftentimes are the ones that encounter victims and survivors and have some time to maybe speak privately to them. If they are trained and know what to look for and have a trauma-informed understanding, that will be a great thing in our community. And it is happening, but we need to put it in all systems. Screening procedures, right? We have to identify people that have experienced trafficking before we can help them. We need broad training in multiple systems. I know that some of these sound a little bit generic, but we had to be concise in how we were looking at providing recommendations. And one of the things was that if organizations were given that in a package, they'd be more likely to launch it. So broad training in multiple systems, commitment to training for law enforcement, our law enforcement agencies, all the way down from the Crimes Against Children unit at Louisville Metro Police Department to the FBI, our local FBI, and others are definitely working on the front lines addressing this. But we also know that with such a large law enforcement agency throughout our city, that there are still needs and gaps, particularly around understanding sex trafficking versus prostitution. And then also focus on racial equity, because we know that equity is essential in the service system when it comes to system change and preventing those vulnerable groups I talked about first from ever becoming victims. All right,
Okay,
next
so-
slide, and then we'll go into discussion.
Yeah, and excuse me just a second. Let me just put out there, if I could, that this is highly informative. And as we go into the discussion, I want to emphasize something we do with everyone, which is that the board does not engage in any operational activity at all. We are strictly interested in what public policies are out there. And we do advocacy only. We don't lobby. We don't do anything like that. So just want to set that background for folks. So thank you, and continue.
Thank you, Heidi. That's really great to have those clear instructions about roles, because we all can play different roles in advancing our work in this area. All right, lastly, before we ask for questions and comments, we need to have emergency and safe housing specific to trafficking victims. This is on my biggest wish list because I have seen survivors enter a healing journey and it be disrupted because they could not find stability. Adequate and appropriate levels of public and private funding. So we know that there is funding for victims, but even the Office for Attorney General, our Kentucky Attorney General and others still have a hard time getting those funding streams to the victims of the crimes. And then we need to support system capacity building efforts. For example, if we had the ability to have screeners available, a five question screening for all first responders, for example, that could be quite a effort to identify more victims. And in our state, unfortunately, in Kentucky, we have high familial trafficking, which is connected to production of child pornography and other sex trafficking, and even labor trafficking of children. All right, and then commit to improving data collection, get more research out there to explore all the intersectionality and all the issues intertwined with causation. And we need collaborative work on this. We're almost halfway through the 20s, right? So we need to collaborate. All right, Lacey, since we're close on time, just give us a little conclusion and then we'll open up questions and comments.
Sure. I just wanted to add, one of the things we found a lot of in our survey was, and we didn't just survey like human trafficking specific agencies. We did a broad social service provider survey, and we found that people know that this is an issue, but they don't necessarily have the tools at their organizations to screen people. And that was really interesting to me. Or once they screen, they're like, oh, I don't know what to do next, because they may be a healthcare agency that is doing a lot of things, not just looking for human trafficking. And so I just wanted to really to bring that to your all's attention for your individual organizations, but also as a whole.
Excellent.
Yeah.
Let me ask this question to sort of kick this off. And then I'll turn it over to Dr. Bautista Severa. Is there a regular collaborative partners meeting, in other words, organizations who, many of whom, Ms. Thompson, I believe you discussed, to meet and to collaborate? I think that's important. And then Deputy Mayor had a question in the chat box as well, related to how LMPD, are they partners and coming to the table and so proceed. And Dr. Bautista Severa, I will turn to you for the remainder.
Okay, yes. So first of all, there is a statewide human trafficking task force that is strong and has been working together since 2013. And that is the operating coalition group at this time in the state. Our Louisville Human Trafficking Task Force unfortunately did not survive through COVID because of just all we all remember that time. And there's a lack of governance or leadership because there really isn't a clear structure there. So there is pockets of groups working on things such as People Against Trafficking Humans, Coalition of Kentucky, also Young People's, the Independent Living Coalition. They address trafficking risks. So there are pockets of groups working on this. And then when it comes to LMPD, they have definitely stepped up in some ways over the past few years because at the state level, they have mandated an hour of human trafficking training. So there is more talk about it, but we still really need to, just look at agency policy within any organization, particularly the first responders, and how they understand the red flags is what we say, or the signs, so that they can build knowledge and awareness. Just like if you think back in the day when law enforcement responded to domestic violence and intimate partner violence, it was different. And now we have better practices and so forth that allow for victims to then be able to disclose that they're victims.
Great.
Yeah, I would just add,
Manson, I believe you have a question.
yeah.
Manson?
Yes, my question is about a class for nurses that we could record and push out through our learning management system with signs and symptoms and then references on what we can do to help. I mean, there are 90,000 of us, and I
Wow.
think we can
Yes.
help if we have some tools to work
Great
with.
point. Great point. Go ahead, Jamie. You know about this.
Well, there are, I would say, at a good place to start would be the University of Louisville's ER department, because they have put in a mandatory screening now. There, that's something that we'll just have to follow up on. I'm sure we can find a connection to the Nurses Association, but even collaborating together, and let's create one and
Yeah. And I
get
would
it
say
out
too,
If you could, thank you for the offer, Ms. Manson. That gives you some power, Dr. McNary. So,
yeah, I was just going to add that, like Jamie said, I think like we don't need to create anything. I mean, we could create something from scratch. My point is there's a lot of resources out there that we could pull together. While some of us, I still remember learning about this for the first time, thinking, is this really, how big of a problem is this? But it is. And so I think just getting the awareness out there that these things are happening in our community, and we all can do something to impact this. But there's also there's several screening tools. Jamie we can send those, some links to those afterwards. But I think that's an incredible opportunity, Delano, to get to 90,000 people that are seeing folks. It's not like people who have experienced human trafficking only go to one place, right? They go everywhere. They seek services in probably all of our agencies and organizations on here. So being able to understand what that looks like and then what to do next is really important.
I agree. It's kind of like you were saying, is being able to identify it, and then what are the references that they can use.
Yes.
And if we have something concrete where we can go and what we can teach nurses, I think we can do a lot.
That's incredible. Yeah, because it's kind of like, okay, if we screen.
Yeah, what's next?
Ignorance is bliss. Maybe if we don't screen, then we don't have to address it. You know what I mean? And so
I think nurses want to do it. They just need to know what and how, and then what's next.
That's great.
Yeah.
I think Dr. Shah has a follow-up question. Dr. Shah?
I think we were sort of talking about it, but at least even as an ER physician, I feel like there were times when the victim had the courage to sort of come forward in the ER, but there was always a lack of resources past that to essentially say, hey, great, we've identified you. Now the last thing is we don't really have great resources, or even as a physician or nurse or any healthcare provider, what do we do next? Yes. And I think that's what's preventing folks from asking that. And especially the other piece of this is it's busy in the ER, right? And I'm not saying, please, I'm not belittling this subject at all, but this sort of the social aspect of this, I think there were clear resources where it was by community, by zip code, who to contact next, I think would go tremendously far if it was protocolized from that standpoint. So I just wanted to throw that out there.
Yes, thank you.
That's such a great observation. And having that ability to respond right there, like trauma-informed things, like when they get to have their urine sample and they have a way to say, I do need help. Even if the help is not delivered right there at that moment, that can be reported to others who can then, look at the situations through that lens. But yeah, I like that idea, even by zip code. That would be a great project.
Yeah,
And-
and
A good proposition. George is, I'm sorry, Dr. Shah, go ahead.
Sorry, and if I may add, even the idea of what the frontline staff can do, right? I mean, it's great to sort of have 5 questions to screen, but it is an awkward conversation, right? To say, hey, this person that's with you, I need to get them out of the room because I suspect that something's off. And I think even that is a difficult conversation in this day and age when you don't know how the other person's going to react. So I think having that lined out, especially in the ER setting, where majority of these folks tend to get identified, would help tremendously.
Yeah, getting some tools for talking about this, asking about this, and some policies in place for what to do. I think that would be a wonderful outcome.
Training nurses, but also for physicians, all the healthcare personnel that deals with this day in and day out, including education. The Deputy Mayor George is asking, what is the recommended screening tool, and is there a cost for this? And we would go in the cold with.
There's a lot of free screening tools. We actually have a whole slide. I just deleted it from this slide deck, but we have a whole slide of screeners for minors, young people, and then there's a free one for adults from the Vera Institute. So yeah, these are available. It's just we have to. There's some in the report that are listed, I believe, but we're happy to provide that at McNary Group because we've been talking about this analysis with others. The Office for Women on the Louisville Metro government side is also a really important resource. They have awareness materials as well, and I believe Gretchen may have a screener. The Kentucky Cabinet for Health and Family Services just released a new screen as well. So yes, there's a lot of them out there. I can commit to this group to get that to Patricia, and then she can share it out.
If you could please share it with Ms. Arlana. She is the board coordinator, and so she'll do a better job than I do. Dr. Singal is asking for brochures. What kind of brochures, Dr. Singal?
We can't hear him, and I'm not.
I'm on the plane. Sorry, I was wondering if there's any informational brochures that you guys have that could be scattered around more of an awareness, signs and symptoms with a picture of.
Oh yeah, there's plenty. Office for Victims of Crime, Department of Homeland Security, FBI. We got the high level ones. And then Kentucky Attorney General's office, Daniel Cameron's office did the Your Eyes Save Lives campaign. There's many different options there. So high level brochures for red flags and signs are available. Yes, we'll get those as well.
Thank you. Dr. Eccles, you have a question?
Yeah,
This could be our last question.
Yeah. Dr. Eccles.
I will try to keep it short. So I, similar to Delano, the Kentucky Pharmacists Association and the Kentucky System of Health System Pharmacists, we've been talking about human trafficking in Kentucky for years now. And I think as everybody has kind of iterated, it's that next step that's really the issue. And for me as a community provider, and with, the Derby coming up, I know that's like a really hot time for a lot of trafficking activity activity. I would wonder in an immediate situation, or in a situation where I'm able to identify, just not as a healthcare provider, but maybe just as a community member, is the best option do I call the police? I didn't even know until Deputy Mayor George mentioned that LMPD has a victim services unit. So outside of organizational kind of protocols, just as a community member and a mother and someone who can identify when there are red flags and issues, who do I call?
Hmm. So I would encourage everyone to call the human trafficking hotline and your local law enforcement office. Now, in Kentucky, our hotline calls go to the Kentucky State Police. So we encourage people to call, we meaning someone in the anti-trafficking community right now, call your local law enforcement, but call the hotline as well. And if there are already agencies like Catholic Charities or other groups, faith communities, if they have the ability to get that victim out of the situation, that's the hardest thing, is getting them out of the situation, because they're so dependent on that power and control in that piece. So local law enforcement, along with the human trafficking hotline.
Thank you very much to our presenters. Thank you, Dr. McNary. Thank you very much, Ms. Thompson. Chair, Madam Chair, the floor is yours now.
Thank you for an insightful and incredibly educational session. And salute the work you do, because it does make a tremendous difference in people's lives, especially those who are most vulnerable. I think each of us learned a great deal from it. Thank you.
Thank you for having us, and we're all in this together. We'll keep at it. Thank you.
You got it. Thank you. All
Bye-bye.
right. Let's see. The chair has, continuing with our business, no additional updates to offer at this point, and calls on Deputy Mayor Nicole George for a mayor's office update. DM?
Good morning, everyone. First of all, I just want to thank the last presenters and would share with you that just yesterday, I met with a local municipality that was very concerned about a collection of hotels they have in human trafficking. And so better understanding the scope and what, we talk about LMPD, but several of our local municipalities have their own small police departments, and there is a gap in training. And of course, I'm particularly interested as we move forward, where are the specific gaps in the service array, so that there is that next step beyond, we've screened, we are applying appropriate enforcement techniques. So anyway, just really appreciate the conversation there. I don't have an update beyond, everyone knows we're in the throes of the budget. And so lots of activity is happening there. And there is lots of activity happening in our health department, but I would defer to my colleagues there to give those updates. Thank you.
Very good. Thank you. And for your commitment, most especially to public service. The chair now calls on interim public health officer Connie Mendel for a brief update, goals for the next 30 to 60 days, as well as any asks she has for the board. Madam Leader.
Thank you, Madam Chair.
Or as I say, my boss.
Everyone should have in their packets a copy of the Board of Health report. Please refer to that. I will give you a couple of highlights. One, unfortunately, as the first item listed is that syphilis is surging, something that you wouldn't think that we would be having a problem with in this day and age, but unfortunately we are, where those case counts have increased by tenfold. So what we're asking for practitioners and those working with pregnant persons that to be vigilant for screening for syphilis at first prenatal visits, at week 28, and at delivery, so we can mitigate and hopefully treat successfully and not have the congenital syphilis cases that we're seeing. Secondly, I just wanted to share that the health department is having a health and wellness fair on March 30th. Please, we will share the flyer. Please share those with your partners and clients. We would love to see a fantastic turnout March 30th from 10 a.m. to 1 p.m. There'll be multiple health services provided, and I think over 20 partners are sharing this with us. So we're really excited to provide this for the community. I did want to share a little bit of good news. At the last meeting, we talked about our concerns for WIC funding. We have seen some bipartisan legislation moving forward to fund WIC, so we're really excited about that. Still working in the Healthy Start area, but we'll continue to ask for those funds to continue serving our most needed patients. And then just lastly, we had a really successful community health improvement initiative kickoff last Thursday. Some of the people on this call were participants. I think we had over 60% participants from academia and healthcare, and our community partners, particularly in the nonprofit service groups. So just excited. I'm asking, as you receive invites to participate in that community partner assessment, please complete those. This is what builds our Healthy Louisville 2030 plan and meeting the needs that are identified, most needed in our community. So please respond to that and also share that. If you don't have that community partner assessment, if you've not received that, please reach out to me or Arlena or anyone and we'll provide you those links. And again, this is the most meaningful work that we do in serving those with least access and most in need. So that's it for me. Thank you, Madam Chair.
And thank you and the people at the health department for all that you guys do daily. Where is the March 30th Health and Wellness Day being recognized?
That will be in our that will be in our forum at 400 East Gray Street.
Okay, great.
And we'll share that flyer for you and the board to share. Thank you.
Great. And then the participant, does that have a list of participating organizations so that if individuals on the board have other contacts, they got it?
Yes, we will provide that.
All righty. Dr. Single, any additional comments, updates, or insights gleaned from the past 30 days and then going forward? But I think I heard you were on a plane. So if that's true,
Yes.
we'll move on.
Yes, I think Tani has covered it all. Thank you so much.
Okay, and thank you for your public service as well. Let's move to committee chairs. Dr. Irwin, Family Health Center's key activities, just to highlight a few minutes, as well as any insights gleaned from that work. And then following that, Ms. Shoemaker, will you share an update from the Medicaid Coverage Coalition?
Yeah, I have a brief announcement. I'm happy to say that on February 21st, Family Health Centers, in conjunction with Jefferson County Public Schools, opened its first full-time school-based clinic at the Iroquois High School. We do have a full-time nurse practitioner. We have part-time mental health, and we hope to expand that. Thus far, we've seen 200 patients, and I'd like to thank the Jewish Heritage Foundation. That, coupled with a federal grant that we were able to receive, is funding this project.
Thank you. Thank you very much. The work you all are doing is amazing. I appreciate it. Let's see, Immunization Committee. Anyone? Dr. Bautista Cervera, could you give folks the name of the chair? Chair?
Ana Kwang, with Dr. Ruth Carrico.
Okay, and
They
Arlena,
had,
if you will get that out to folks so they are aware. Thank you. Let's
ma'am.
see. We heard from Dr. Hargett. We heard from Ms. Manson. Is there anyone else on a committee who, let's see.
sorry, Madam Chair, Dr. Echo is our link with the community immunization advocacy committee. But this time I was present at the meeting and nothing to share. Two news with the CDC. There is a recommended second dose of the actual COVID vaccine for those older than 65 years after 4 months of the first application. And this is just to allow to continue a high level of antibodies on their system. The second one is the CDC also published that this last vaccine, the updated vaccine, not only covers the first Omicron variant that it was created with, XBB 1.5, but also covers the one that is causing still 20,000 hospitalizations per week or 2,000 deaths per week, COVID at this time. And that N1 is the one that is covered, and it's doing a good job. And the best news about this is that there's also new research that says that the risk of getting infected if you have received the vaccine, it's prevented up to 54%. This is research information published by the CDC. So I thought this was important to share.
Very good. Let's see, where are we here? Anything else from Family Health Centers or Ms. Shoemaker?
Coalition meeting was
Can you speak up a little, or maybe it's just my laptop?
okay, yes, can you hear me?
Yes, ma'am.
Okay, our last meeting was on February 12th. We are seeing Medicaid recertification numbers start to stabilize, but here in Jefferson County, we have seen a net decline of about 10% who have lost Medicaid since the start of the Medicaid unwinding. And that number does also track with the state as a whole. We've got a couple more months of the unwinding to go. The last round of recertifications for adults is due April 30th. And then in the near future, we will also have child renewals, recertifications. It could be as early as September, where about 600,000 children across the state will need to complete Medicaid recertification. So we have done a lot, made a lot of progress, but we still have a lot more work to go. Our next meeting is scheduled for April 8th at 4 o'clock.
Very good. Thank you for bringing together this collaborative. It's a great example of the power of collaboration and non-duplication of services. So, great. Is there any old business to come before the group? Is there any new business to come before the group? I really want to thank folks for joining today, and to reiterate that our next meeting is April 10. And for those of you with children in public schools, enjoy a wonderful spring break. I think we've had a spring break from winter here, and I hope that everyone heeds Dr. Bautista Cervera's monition on on vaccines and vaccinations. And again, I thank Dr. Shaw for agreeing to public service as well. So if there are no objections, this meeting will stand adjourned. Any comments, final? All right, the meeting stands adjourned, and please stay and be well. Stay away from the norovirus.